I knew I always wanted to be in healthcare and I wanted to help people. Besides that, I wasn't sure the aspect of what I wanted to do exactly. They had actually a job fair, and Fresenius came and they were talking about the aspect of the nurse and patient relationship that I could have. And at that moment I was like, this is exactly what I was looking for. They said nursing is about supporting your patients and being their voice when they don't have one. And I said, that's exactly what I want to do. I want to know my patients, I want my patients to know me, and I want to know their story, and I want to know where they end up and what happens to them. And in other places I wasn't going to get that. But when Fresenius introduced me to dialysis, I was like, you know what, I want to be here. So then I applied and I started working here. I wanted to jump in and do the kind of nursing that I loved. They had extra classes, but I was part of the program that gave me a little more in-depth to nursing as a nephrology nursing, and I think that helped me understand things a little bit better, where I wouldn't have gotten that if I was, a new nurse on a floor. They went a little bit in-depth to support you, knowing you were a new nurse in general, and knowing you were new to nephrology. They made sure to emphasize that as you're not just a new nephrology nurse, you're a new nurse and you're a new nephrology nurse. So they made sure you had a little bit more background to help you be successful. I would say the education team is absolutely amazing. If I needed any question or concern I ever had the whole time I was here, from day one, even if I had a question now, I could go to them and talk to them, and they would provide me with anything I needed if I needed to know about a new policy or any questions. And my manager was like, I really think you'd be very good at this. And I said, you know what, I think I'm willing to, give it a try. And then it turns out I really love my job. In general, to pre-licensed nurses, I guess, my biggest advice would be to just jump in. It may look scary and it may look intimidating at first, but I promise them after a while, if this nursing is truly your passion and truly something that you love, jumping in head first is probably the best decision you'll ever make.